Good afternoon, I'm Dr. Cliff Davis. This video will briefly cover prostate artery embolization, a treatment for BPH or enlarged prostate performed by interventional radiologists. I'm an interventional radiologist, assistant professor at USF, and member of Radiology Associates of Florida and RAD Partners. Prostate artery embolization is an outpatient procedure in which a tiny catheter, about 1 millimeter in diameter, is threaded through the artery feeding the prostate under X-ray guidance. The prostate arteries are then blocked with microscopic particles, which is termed embolization. To reach the prostatic arteries, I typically access the left radial artery in the wrist and thread the catheter to the pelvis under X-ray guidance. After several weeks, this causes about 30 to 50% of the prostate to die, called necrosis, which is then absorbed by your body. Importantly, the area of the prostate that does necrose is compressing the urethra, which is the urinary tube that connects the bladder to the penis, and thus relieves the pressure on the urethra and improves urine flow. Total hospital time is about 5 to 6 hours, and the procedure takes 1 to 2 hours under twilight sedation. A urinary catheter is not required for this procedure. As for who is a good candidate, really, the bigger the prostate, the better. Most traditional surgical procedures for BPH have increased risks of bleeding and complication as the prostate size increases. However, PAE seems to be more effective and easier to perform in very large prostates, those greater than 100 cc's. Prostate size is determined by MRI, transrectal ultrasound, or CT scan. Personally, I do not perform PAE on patients with prostate size less than 60 grams. Patients on anticoagulation can get PAE without stopping the blood thinner. PAE treats bleeding and does not cause it. It is safe to access the radial artery in the wrist with blood thinners in the body. Patients with urinary retention that have a Foley catheter in place can get PAE to shrink the prostate. Generally, the catheter can be removed within 10 to 14 days of the procedure. Patients who have had a previous TURP, microwave therapy, or a urolift to their prostate can get PAE. PAE does not preclude any other therapies in the future. Who is not a good candidate for PAE? Unfortunately, PAE is not used to treat prostate cancer. I will occasionally perform PAE on patients with Gleason 6 prostate cancer if they are on active surveillance and have been stable for several years under the care of a urologist. We do not perform PAE on patients that are trying to avoid a workup by a urologist. To determine what the causes of slow urine flow and frequency are, we must assure the cause of the obstruction is BPH and rule out bladder, kidney, or prostate cancer. Patients with prostate size less than 60 grams are also not great candidates for PAE unless other surgical procedures are too high risk due to other comorbidities, such as heart failure or emphysema. Patients with neurologic diseases such as advanced Parkinson's disease, previous stroke causing bladder weakness, or neurogenic bladder tend to be poor candidates. The bladder is often the cause of the low flow in these patients and not necessarily BPH. To determine if these diseases are affecting the bladder, we can perform a test called urodynamics to evaluate the bladder muscle strength. Patients with advanced peripheral vascular disease or plaque in the arteries and the legs can prevent access to the prostate arteries and tend to be poor candidates for PAE. Most are smokers and have diabetes. Patients with chronic renal failure are poor candidates, as contrast used in the procedure can further injure the kidneys. All patients referred for PAE are evaluated in clinic or by telemedicine prior to the procedure. The pre-procedure visit is to evaluate other comorbidities or risk factors for complications, determine if other procedures may provide better outcomes, or if PAE is safe for you. During clinic, we will review your medications and have you fill out forms called the IPSS and the IIEF score, which evaluates your urinary and erectile dysfunction on a numerical score. If we feel you need additional testing or not a good candidate, we will refer you to a urologist at our center or back to your urologist. Once we feel you are a good PAE candidate, you will be scheduled for the procedure 1 to 2 weeks later. The day of your procedure, your total hospital time is 5 to 6 hours. Prior to the procedure, we take blood tests to assure you are safe for contrast and sedation. The procedure is performed with twilight sedation, which is enough for patients to sleep and have little to no memory of the procedure. PAE takes about 1.5 to 2 hours. During the procedure, we use advanced techniques to determine the blood flow to the prostate and avoid any other organs such as the intestines, bladder, or penis, utilizing cone beam CT. Cone beam CT is a CT scan that is performed while during the procedure and can show us exactly the organs the arteries are feeding to assure we are blocking the correct vessels. If we use the radial artery in the wrist for access, Patients wear a wristband over the punctured site for 2 hours to let the puncture seal prior to discharge. Radial wrist access and the TR band after the procedure allows patients to sit up, walk to the bathroom, eat and drink during recovery. Immediately after the procedure, most patients feel no pain or symptoms. However, almost all patients have significant dysuria, which means burning during urination. Some with very large prostates will have this pain even longer. Increased frequency typically accompanies the dysuria, so most patients are urinating about twice as often, and it burns every time they urinate. It can be relatively severe, which patients don't expect since the procedure is minimally invasive. The pain and frequency are often worse at night, which makes it very difficult to sleep. To treat these side effects, we prescribe patients with several medications after PAE, including antibiotics, anti-inflammatories, a medication to decrease the dysuria, and a strong pain medication. These will be sent electronically to your pharmacy, and you can pick them up on the way home from the procedure. After several days, the frequency and dysuria resolves. Urine flow does not start to improve for 2 to 3 weeks. Then, as the prostate shrinks, the urine flow will begin to improve every few days. The prostate continues to shrink for 6 to 12 months. Patients with an existing Foley at the time of PAE should have it removed about 14 days after the procedure. Follow-up from our office will include a phone call to the patient a couple days after the procedure to assure everything is going well. If we are concerned, we will check on you several more times the first week. We will then schedule all patients for a telemedicine or clinic appointment 3 months after PAE. This gives me the best idea of whether a patient is going to have a good outcome. Although the prostate will continue to shrink after 3 months, most patients feel significant improvement in their flow and frequency at this time frame. Complications are very rare in PAE. The major risk we have encountered has been urinary tract infections after PAE that infects the prostate. This is the only complication we have experienced that required hospital admission. This has only occurred with patients with previous history of multiple urinary tract infections. We watch patients more closely and treat with longer antibiotics if they have a history of multiple UTIs prior to the PAE, as it increases the risk of post-op infections. Other risks such as bladder, intestine, penile injury have not occurred in our practice. Bleeding is generally not caused by PAE. Impotence is very rare when performed by an experienced operator. There is a low risk, about 1%, of requiring a catheter after the procedure, which is due to the inflamed prostate blocking the bladder. Other factors of PAE such as sexual activity, longevity, and medications use after PAE will be discussed in the clinic prior to and after the procedure. We hope you found this video educational. Thank you for your time.